Providence recorded an all-time high number of COVID-19 cases. Good morning, everyone. I'm LaDawn Davis, and this is a Morning Edition. Thank you so much for tuning in. So far, it's the highest number of cases for a single community in the daily COVID findings. Out of the 53 new cases on Thursday, New Providence accounted for 51, including the 9 pending cases. There were 2 new cases over in Grand Bahama. Currently, New Providence has a total of 546 COVID cases, Grand Bahama 440, and the nationwide count now stands at 1,089. With the growing number of cases now coming out of New Providence as well as the Family Islands, we questioned the Deputy Chief Medical Officer, Dr. DeLon Brennan, about the COVID-19 protocols in the islands and concerns over the current spread of the virus in communities.
For those in New Providence, it continues to be a concerning issue, but not an unexpected one. What it means that the idea that we knew that there would be an increased number of cases given the exposures and the numbers we were already seeing via the modeling are just bearing fruit, even with decreased amount of interaction due to some of the lockdowns and curfews. We knew that those who had been exposed would now be presenting because they are having symptoms, and those who were not having symptoms were identified via contact tracing. Some of those individuals were going to be found and tested, and they were going to show up as positive. So it's well within the expectations of what was going to happen, but it also should bring some awareness to the public that this disease continues to be out there. It's affecting individuals. It's growing in a way that we would be able to predict. And if we don't take the measures that have been put in place seriously, we will continue to see increased numbers, and we will start to see some deleterious effects on our population.
I'm keying in on that component of exposure. On Monday, Wednesday, and Friday, as well as during the weekend, there is some level of exposure within members of the public and essential staff on the weekend. Is this a challenge moving forward?
Yes, absolutely. It's a challenge. I know the government is making an attempt to balance the issues around the economy, access to resources and food, whether, that's money when banks are open, medications and the like. So it is quite a balancing act that they have to perform. From a healthcare perspective, we would love, honestly, for us to minimize or eliminate all potential exposures and have everyone eliminate their ability to interact for, a period of time, ideally between 2 weeks and 4 weeks, that would allow us to be able to make sure that virus transmission is gone to an absolute minimum. But unfortunately, because people still have to eat and still have to, access some of those services, it means there are going to be additional exposures. So we have to take that in mind and realize that it is going to be a slow turn toward the better as we try to implement measures but also balance those other social determinants.
I know it may be a little early, but we're yet in August, and traditionally the school semester starts around the end of August, early September. Have there been any initial discussion or suggested protocols for possibly reopening schools?
There has been some discussion. I think when we've seen the communications from the Ministry of Education, that their expectation is that they will be able to resume school services around the 3rd week of September. And that's our expectation at present. We are working hard with all of our partners to be able to make sure that that's a reality. The volume and the increase and burden of disease that's going on in country will really dictate. And a lot of that is just predicated upon how we will, as a populace, will approach the exposures, our movements, our ability to decrease the spread of this disease. And if you were to ask, is it possible that we could have it underway, under wraps in a way that we will not necessarily have as much disease by that time? Absolutely. Can we do it? Absolutely. But do we have the will to sacrifice during this present time period to make that happen? And so far, that's been more of our challenge, just our willingness to do what is necessary in order to get this right.
You will hear more this afternoon from the COVID-19 health team about the challenges facing the Bahamas and those efforts to mitigate the spread of the virus. Now, a Ministry of Health press conference is set for 3 o'clock this afternoon. It will be carried live on the ZNS television and radio network.